You know, hundreds of thousands of people experience a stroke each year, but there are ways to keep yourself safe and support for those who have suffered a stroke. Dr. Andrea Toomer from the Culicchia Neurological Clinic and stroke survivor Sarah Abrusley are here to tell us more. Good morning, ladies.
Good morning, Liz.
Thank you so much for coming in. Tell us exactly, what is a stroke? What happens to the body when you have a stroke?
Signs of a stroke are sudden loss of being able to move, such as your arm or your leg, problems with vision, problems being able to speak. You would certainly want to seek medical attention immediately if you had any of those symptoms.
And Sarah, what was your experience like?
My experience has been very challenging, yet very enlightening. And I think that many people, of course, in New Orleans, can think of a stroke as a sudden hurricane to the brain, a brainstorm, in fact.
That's a perfect way to, to describe it.
The sudden onset, the lack of knowledge of exactly what's going to happen, and then suddenly you're left picking up the pieces. It's quite scary, in fact, which is why at only 29.
Is that because it's hereditary? What was your situation?
For me, I was born with a genetic predisposition to having a stroke. I had something called a cavernous hemangioma. So it's like an arteriovenous malformation, a little tangle of blood vessels that in fact wasn't supposed to be there, and mine chose at any point in my life just to explode one day.
Oh my goodness. And doctor, what are some of the treatments available to help patients like Sarah?
Sarah had left-sided weakness. After she did her initial rehab, she started to develop spasticity, or increase in the muscle tone in her left arm. So in addition to the physical therapy and occupational therapy that she was doing to work on her arm and leg, we do Botox treatments. She has increased muscle tone in some of those muscles, and she can't overcome that. We do the Botox injections directly into those muscles to relax them so that she can then use her arm much more functionally.
That's great to see Botox is used for something other than
absolutely,
right?
I love to tell people, perhaps I look young, but I only get Botox in my PIP joints, just in my fingers.
So there's progress out there for those who have loved ones dealing with it, which is basically the headline of this.
And we are meeting this Thursday at West Jefferson Medical Center. We have a support group for anyone with brain injury or stroke. And we will be talking specifically about treatments for spasticity and treatments for pain that can happen in your arm or your leg after a stroke or a brain injury.
Well, it's good to see that there's somewhere a support group for people to go, because once you're hit with something like that, as you know, Sarah, it's just like life-changing. And I know there are many things, we were talking about this a little bit earlier, so many things you can do, but what are some of the key things that may lead to a stroke? Are there any specific things you can do?
Risk factors that you would want to modify. You want to make sure that you're going to your primary care physician regularly, that they're checking your blood pressure, that they're checking your cholesterol. You want to eat a healthy diet, lots of fruits and vegetables. You want to exercise at least 30 minutes 3 times a week where you're getting your heart rate up. And you don't want to smoke, absolutely.
Right, and that's the key thing you were saying.
That's the greatest thing in our control for preventing a stroke. And of course, May is Stroke Awareness Month, which is another reason why Dr. Toomer and I are here today.
And we're so glad you were here. Y'all did a great job of getting the word out. Thank you so much. And hopefully, you won't have many more patients that will have to deal with this. But the bottom line is there is hope and there's treatment. And good luck with your progress.
Thank you so much, Liz. It's all about rebuilding the new version of yourself after suffering a stroke.
Thank you very much.
Thank